I'm Mark Campbell. I'm a medical oncologist in Grand Rapids, Michigan, and I'm going to help you understand what is cancer. What is cancer? What happens when cancer starts? Kind of a simple way, and much of what I'll say is going to be oversimplified. It's not going to be precise, but it's to try to help you understand exactly what the battle is about. But the cancer cells is really a group of cells that go berserk. They go out of control, unregulated growth. So that if we are right now being fearfully and wonderfully made, nothing's going on. But if suddenly we cut ourselves, a signal goes to the body that, hey, we got to mend this, whether it's a broken bone or it's a cut in the skin. And suddenly an on switch. And one of the metaphors that I like for cancer is it's a on switch that's broke and goes on when it shouldn't have, and an off switch, it isn't working right and it doesn't go off when it should go off. But what will happen now in our body, again, a signal goes to make new, in this case, skin. And it will fill in that gap and then go off. But what if it doesn't go off? What if it just keeps piling up? Well, then it's being unregulated growth. So if that signal shouldn't have gone on in the first place, there wasn't a cut, but somehow the on switch went on and the cells began growing. Or they legitimately went on, but they didn't stop when they should have. Then we would call these growths, this accumulated of tissue, a tumor. And we have two kinds of tumors. We can have tumors that are malignant, and we can have tumors that are benign. Both of them can be bad at times, and both of them are good. The most common cancer in America, perhaps, is skin cancer. And while it can spread all over the body, thankfully, most of the time it doesn't. And another group of tumors that are benign. Well, what's the difference? Well, let's say that we had a bone nearby, and we have a muscle nearby, and a tumor, a cell goes berserk and starts growing when it shouldn't, and it's benign. What will it do? It'll push things, adjacent structures away, but that's pretty much it. Now, it can still be bad. A good friend of mine had a pituitary tumor, and it was benign, but by the time it was discovered, it had put so much pressure on the nerves next to it, he was blind. So you can have a benign tumor in a bad location that maybe gets recognized late, and you can have very serious side effects of that. So that benign tumor may need to be removed so that it doesn't cause a problem, but it's benign. Well, how is that different from a malignant tumor? Well, malignant tumors do two or three things that are unique. One is it's growing next to, in this case, the bone. It can actually eat into the bone. Like you took a shark bite out of the ski, and you got this chunk missing. The other analogy I think of in the old days, we don't see it as much anymore, but there'd be a rust spot on the metal of your car behind the front wheel. A hole right through it. It was hard metal at one time, and now it's a hole right through it. It's been invaded. So this tumor can actually eat into and invade whatever it's next to. And it doesn't just want to push aside politely what it's adjacent. So it invades and it eats into the structure next to it. The other characteristic of malignant tumors is it can break off little pieces. And then those little pieces can travel, usually through a blood vessel. They'll break off, they can get into a blood vessel, float to another part of a body, say, and maybe drop that seed perhaps in the lung or the liver. So the analogy might be that the dandelion from your neighbor's lawn blew across the street onto your lawn, and it's beginning to grow at a new location. They're both dandelions, and we've changed location. And that new location we call a metastasis, or in our jargon, for short, we would call it a MET. But this is going to be whatever its parent was, but it's in a new location. And this ability to metastasize and invade is the characteristics of a malignant tumor versus a benign tumor. Both can be bad if it's the wrong situation, And fortunately, again, like the skin cancers, they may be invasive, but thankfully usually do not spread all throughout the body.